The one thing I wanted to point out from the beginning is that this data, most of these graphs show data through mid-October. As you know, the past approximately 10 days of data are not always complete. And so our modelers really only like to show, the data where, we're really confident in the data that is complete. So this first graph shows the estimated reproductive rate in Eastern and Western Washington. And I think you all know by now that the reproductive rate is the number of people that will be infected from one given case. We want this number to be less than 1 because when the number of reproductive rate is less than 1, the outbreak gets smaller. When it's greater than 1, the outbreak grows. Unfortunately, around mid-October, the estimated reproductive rate was around 1.3 in Western Washington, indicated in the turquoise line, and was about 1.1 in Eastern Washington, indicated in the pink line. The vertical lines represent the degree of uncertainty. So the true point could be anywhere on that vertical line, but the best estimate for both Eastern and Western Washington is now greater than 1, which is not where we want it to be. Okay, this next slide shows cases and hospitalizations in both Western and Eastern Washington. The top graphs represent Eastern Washington data. The bottom graphs represent Western Washington data. And you can see in Western Washington throughout, September and early October, they've seen a really sharp increase in the number of daily positive tests. Those are our cases. And if you skip over to this third graph on the right, you can see that hospitalizations on the west side of the state are also increasing, which is very concerning. In Eastern Washington, the incline in daily positive tests is not as sharp as it is in Western Washington, but the same sort of upward trend. And then the hospitalizations are bumping around a little bit, but also appear to be slowly increasing. So this graph shows cases that are the epidemiologic curves for confirmed cases in every single county. And what I want to point out is that the recent growth that we are seeing in our outbreak here in Washington is really pretty widely distributed. So there's not just one county on the east side or one county on the west side that's accounting for the increase in activity that we're currently seeing. As you look across this slide, you can see that there are many counties that are in an upward trajectory. A few counties that I'm particularly concerned about are Snohomish. You can see that Snohomish is on a very steep incline, almost a vertical line. Pierce is also on a pretty, rapid increase, along with Thurston County and Clark County. But we're also seeing increases in a lot of our central Washington counties as well. But the increase is just not as sharp as some of these increases as we are seeing on the west side. So our modelers also break down our cases by age group. The top graph represents the age of the cases in Eastern Washington. And the bottom graph represents the age group for cases in Western Washington. And as you can see, we're seeing greater inclines in Western Washington among cases. And you can also notice that these increases are happening in almost every age group, with the sharpest increase happening among the 25 to 39-year-olds and the 40 to 59-year-olds. But concerning, we're also seeing increases in those over 60 when it comes to cases. This indicates that disease in the population is very widespread as well. So in summary, COVID-19 transmission is increasing across the state, but particularly in Western Washington. The recent growth in cases is widely distributed geographically, but also distributed among age groups as well. And transmission does continue to occur in multiple settings. Right now, we are particularly concerned about private gatherings, as Lacey discussed, but we are still seeing outbreaks in other, workplace settings as well. And I encourage you to take a look at our outbreak report, which we update once a week. And then lastly, I just wanted to point to some data that I discussed yesterday in the governor's press conference. The UW Institute of Health Metrics has on their website some projections about what we might expect this winter. And the red line indicates the number of daily deaths that have been reported here in Washington. This data is smoothed. And then you can see that this line, this purple line, indicates the number of daily deaths we might expect moving into the winter if we, keep our conditions as they are now. And what I wanted to point out is that they have predicted that if we are able to achieve universal masking, that is more than 95% of the population wearing masks all the time, we would see a much lower number of deaths every day going into the winter. And I just wanted to highlight this data and put in just another plug for the importance of wearing masks. Whenever you're with anyone outside of your household, this does not mean just wear them to the grocery store and wear them at work. It means to wear them during your break, during your breaks at work, to wear them when you're in cars with friends, and to wear them in your house when you're having people over from outside of your household.